University of Manchester, this is where we are based, and I'm going to talk a little bit about the team there. So we work in the Centre for Mental Health and Safety at the University of Manchester, and I see some of the team are around there in the little boxes today. We have a number of different research groups in this centre, including some very long established research groups. So we have the National Confidential Inquiry into Suicide and Safety in Mental Health Services and the Manchester Self-Harm Project. So they've been going now well over 20 years. Then we also do these National Institute for Health Research funded projects. And I've been leading self-harm research on these projects for about 12 years now. One of the projects that we're funded by is the Patient Safety Research Collaboration, which is one of 6 PSRCs around the country that look at different issues around patient safety. And we'll send out details about if people want to subscribe to the newsletter. We will send out details in the follow-up email. We do a lot of different types of research at the Centre for Mental Health and Safety. So, for example, we do big data and quantitative research where we look at numbers and statistics. Then we do a lot of epidemiology. So we might look at patterns or how often something might occur in the population. We do a lot of qualitative methods. So, for example, ethnographies, focus groups, and interviews. A huge amount of patient and public involvement. And then a lot of policy work. So, for example, things like working with the NICE guidelines or suicide prevention strategies. And the leads for the centre are Professor Nav Kapoor, Lewis Appleby, and Roger Webb is one of our bosses as well. Okay, so it goes without saying that self-harm and suicide are really sensitive topics. And for a long time, involvement work in this area lagged behind other areas because people were always apprehensive that talking about self-harm and suicidal behaviour was going to lead to further self-harm or suicidal behaviour. And I'm sure there will be lots of people here who would be familiar with ethics committees who would be very gatekeeping around who should be involved in research. Thankfully, there is a lot of research now that shows that talking about self-harm and suicidal behaviour does not lead to further self-harm and suicidal behaviour, and that it can be beneficial. And we've seen this, I've seen this throughout my career about being involved in research and how powerful that can be, and how valuable it can be for everybody. But that doesn't mean that it's not emotive and that it can't be triggering about people's experience, particularly when you're doing health services research. And a lot of people, particularly around this area, might have very negative experiences with health services. So for us, well-being is always the number one priority. And Liz is going to talk much more about all of these things in a couple of minutes. We set up our involvement group. So this involvement group is set up about 7 years now. And we set it up in response to a lot of the limitations that we found in involvement work, where people would be involved in one specific project and then that's it. You would end up losing the experience and the relationships and the skills. And we wanted to set up a kind of a permanent residency where we could really invest in building relationships and building those skills. And people could work across lots of different projects and really excel and thrive in this environment. People can be involved as much as or as little as they want right throughout their research cycle, from developing research areas and research questions to analysis and dissemination. People are co-researchers on grant applications and projects as well. We also do things like public engagement events. So this is one that we did for World Suicide Prevention Day, where our members created these artworks that represented what hope meant to them. And we had it in Rates Hall, right in the centre of Manchester, and we were able to talk to people about the importance of patient involvement in self-harm and suicide prevention research, and about hope, ultimately. Our members have also been recognised for how brilliant they are. So this is one of the awards that they won at the University of Manchester. So there are a lot of standards and guides for patient involvement. And in fact, our resources that we developed are meant to be read in conjunction with these. So for example, we're very closely aligned and follow the UK standards for public involvement. If anybody hasn't read them, I'd highly recommend having a read of them. We have all of these links and more in our resources that we have developed, which you will receive after this meeting. We are funded by the NIHR, and the NIHR have lots of different excellent resources around patient involvement, including a very comprehensive payment policy that myself and Louise know very well, and Louise Gorman is out there in one of the little boxes, and we have done an awful lot of work around pay. We think it's fundamentally important, and we follow the best practice guidelines from NIHR around pay. And we also have sections in the resources about that. But, you know, you can talk about these things and you can learn guidelines and resources, and we've developed them, but there is no better thing than actually learning from experience. And on that note, I am going to hand over to Elizabeth Monaghan, who's going to talk about patient and public involvement from a public